There is something of a coincidence here too, bearing in mind that you had the results of the Mental Health Royal Commission, the findings that came out yesterday indicating catastrophic failures. It's interesting that that was released yesterday because so much mental health problems had originally come from border shutdowns.
Well, Peter, as I was sitting there in the exhibition buildings yesterday listening to all this well-meaning commentary from the government with regards to improving the mental health system, I did reflect that one of the biggest impediments to Victorians' mental health was the state government's 4-month-long lockdown last year, the 250,000 jobs lost, and the huge impact those lockdowns have had on Victorians' mental health, the drug and alcohol issues that have resulted from that massive lockdown, the social dislocation caused by that lockdown, border closures, people not being able to see their family and friends for literally almost an entire year in some respects. Not acceptable, should never have happened, and I think there's this massive, massive contradiction between the big set piece yesterday around mental health and the actual impacts on government policy and the Andrews government's failures over last year with regards to contact tracing and hotel quarantine that resulted in the second wave, 801 deaths and 250,000 jobs lost.
Just onto that report that has been released, it looks as though there's going to have to be an overhaul of it, similar to the aged care report that came out the other day, kind of rebuilding it from scratch. Obviously, it's going to come at a huge cost, and there has been some suggestions in Victoria that there would, similar to the aged care report, that there would be a tax levy that would be applied to this for Victorians. Would you support that?
No, we don't support that at all. We don't support a mental health tax. This is a very important issue. This is a fundamental role for the state government to provide mental health care, and this should come out of recurrent revenue. And indeed, this Labor government has borrowed $150 billion. They don't need another tax to fund a core service of a state government.
Okay, so what's the alternative? What would you do? How are you going to raise this money? Because like aged care, again, it's interesting that both of them came out this week. They're both going to cost a lot of money.
Well, firstly, stop wasting so much money. This Andrews Labor government down here in Victoria, spendthrifts, they borrow so much money and they waste so much taxpayers' money. There are so many major projects, for example, the Westgate Tunnel, that are billions of dollars over, years behind. This sort of treatment of taxpayers' money that treats it like an ATM has to stop. And the consequences of treating taxpayers' money like an ATM means that you can't afford to do important services like mental health care when you're wasting so much money on other major projects.
Okay, Liberal MP Tim Smith, thanks for coming on. Talk to you soon.
Thanks, Pete.